Contemporary dream scholarship continues to reveal hidden dimensions and applications of the world of dreams. Many psychologists, especially those involved in therapy, have recognized the value of dream analysis. While dreams may help sort the information in our brains, they may also help us consider information that we ignore when we are awake. Studies have shown that incorporating dream analysis in therapy can be significantly more helpful than sessions without dream work. Dream insight is not just a cognitive phenomenon, but can contribute to significant changes in everyday life. Dream analysis can open avenues to better coping with problems worked on and lead directly to a reduction of depressive symptoms. It can improve subjective well-being. Despite these potential benefits, therapists often feel unprepared to explore dream analysis in their practice because dreams are typically not addressed in clinical training. The purpose of this presentation is to touch on topics which provide a sense of the breadth, relevance, and dynamic potential of dream analysis, to encourage further exploration and education in its potential value in psychotherapy. Some of the oldest written texts ever discovered are devoted to describing and interpreting people's dreams. The ancient Sumerians in Mesopotamia have left evidence of dream interpretation dating back to at least 3100 BC. Historical study shows that dreams were a central part of ancient religions. The Babylonians and Egyptians believed dreams were prophetic and held heavenly meaning. Philosophers of antiquity interpreted dreams as psychological phenomena and viewed them as the life of one's soul while asleep. In the middle of the 19th century, the first scientifically based modern dream research emerged, but it was not until Sigmund Freud published The Interpretation of Dreams in 1900 that a systematic theory and practice of dream analysis was developed and advocated. Freud's protege Carl Jung became a progenitor who developed new dimensions of dream analysis, which evolved into branches of psychodynamic modalities. Jung emphasized wholeness for each individual, opening related therapeutic gateways through dreams, archetypes, myths, and the collective unconscious. The information available via modern techniques of brain imaging has provided new empirical basis for the study of the dreaming brain. There is a relationship between clinical dream work and the emerging field of interpersonal neurobiology. The neurophysiology of REM sleep, and in particular recent insights into its regional activity patterns, offers a useful starting point for relating dream phenomenology to underlying brain activity. Electrochemical pulses from the brain stem create the stage of sleep in which most dreams occur. When dreaming begins, the middle brain lights up with measurable activity. The most prominent emotional themes in dreams are fear, anxiety, anger, and confusion. Mental states, which relate to the function of the amygdala, supporting its role in the dreaming brain. Science is moving beyond focusing on sleep stages when trying to link dream consciousness to neuronal events, and it's probing more subtle features of brain activity in space and time. Converging evidence from multiple fields of study, including phenomenology, neuropsychology, functional imaging, and neurophysiology, support the connection between dreaming and waking imagination. Viewing dreams as a powerful form of imagination can help explain many of their unique features, such as sudden transitions, uncertainty about people and places, poor subsequent recall, disconnection from the environment. Understanding the genesis of dreams offers testable predictions for future studies in addiction, trauma, and PTSD. In contemporary America, the intensity of feelings of fear, shame, anxiety, rising numbers of victims of intimidation and abuse, verbal, physical, cyber, post-traumatic stress disorder, rising addiction levels, nightmares, sleep terrors, suicide ideation, can overwhelm the scaffolding of commodified mental health like a tsunami, threatening to buckle under its foundation. If we actually understood that all behaviors are for the most part coping mechanisms for emotions that we are not able to deal with, we are not seeing what's driving them and what's underneath them. To help cope with emotional trauma, there are new ways of working with dreams and methodologies that have demonstrated benefits that are indispensable for specific conditions. Dream analysis and dream interpretation have been used successfully to deal with all manner of traumas and emotional issues. Nightmares can be both a crippling symptom, but also a pathway to remedies. Imagery rehearsal therapy has been shown to significantly reduce nightmare frequency and distress. Using dream work, mechanisms of emotional memory reconsolidation incorporate and connect what is accessible in specific steps toward emotional transformation. The current scientific theories that have the most support suggest that dreams facilitate the consolidation of memory and the process of emotional regulation. In dream analysis, fundamentals such as a person's age, gender, family structure, and social economic status contribute to the shape of dreams. Yet dreaming also reflects the individual's cultural environment, the language, customs, concepts, and practices of their broader community. A new wave of anthropological research is expanding our knowledge of how dreams reflect and actively respond to cultural, social, political, and religious influences in people's lives. Especially in times of collective change and crisis, dreams become a powerful source of insight into the dynamic interplay of individual psyche and the cultural matrix. These phenomena can be bidirectional. The mental reality of dreaming can create a night residue effect in people's lives, their memories of dreaming unconsciously directing or influencing their waking behaviors and personal ontologies. Today, dreams can reawaken the trauma of white supremacy, racism, xenophobia, homophobia, transphobia, and the systematic devaluation of women. To the degree dream analysis helps bring these meanings into conscious awareness and enables their integration with waking life identity, a kind of natural therapeutic process can emerge with potentially transformative effects for individuals and communities. Dream analysis can be a liberating force. Through the lens of psychodynamic conceptualization of dream analysis, we can capture the universal moments of cathartic realization. Those who embark in dream analysis must enter into the experiential relationship with the client, which includes awareness and humility about the impact of cultural factors at work. The culturally competent dream analyst is one who is actively in the process of becoming aware of their own assumptions about human behavior, values, biases, preconceived notions, and personal limitations. Working with dreams and the unconscious requires ethical sensitivity and special care. Ethical concerns in dream analysis relate to the imbalance of power between the client and the therapist. Always a concern in therapy, in dream analysis, the therapist takes an expert role by offering the patient an insight into their unconscious. The client is reliant on the therapist's insight without mediation through external checks and balances. A related concern in dream analysis is vulnerability to false memory syndrome. Every dream may have multiple meanings, and different techniques may be reasonably employed to touch these multiple layers of significance. Allowing one interpretation or potent set of images to acquire a heightened or exaggerated reality can cause consequences. A distorted memory, or the suggestion of later false information, can affect how we recall events we experienced firsthand, or lead to belief in the occurrence of an event that never actually happened. A person's existing knowledge can also obstruct or distort their own memory that does not accurately reflect their reality. Ethical boards recognize these potential risks and support an approach to dream work and dream sharing that respects the dreamer's dignity and integrity, and which recognizes the dreamer as the decision maker regarding the significance of the dream. Ethical dream work helps the dreamer work with their own dream images, feelings, and associations, and gently helps the dreamer to more fully experience, appreciate, and understand the dream. Scholastic research has found that a majority of therapists are not comfortable with dreams because they feel they lack the necessary specialized training. Far from being standard practice, the use of dreams is now rarely taught to new clinicians, unless they are specifically pursuing a modality such as psychoanalysis, Jungian or depth psychotherapy, where dream work remains central. Experts in psychodynamic pedagogy strongly believe that as therapists, ignoring the dream is to our detriment. Dreams go beyond therapeutic guidance and can unlock insight, healing, and transformation. The beauty of dreams is that the information they bring comes directly from the dreamer, unfiltered and unhampered. They simply tell it like it is.